Is there anything specific, specific types of research that have piqued your interest when discussing Parkinson's disease?
Well, I'm a clinical trialist by nature, so by training as well. And so I test different drugs and devices that can improve the lives of Parkinson patients. Of course, the holy grail to us is to find the cure, to find that drug or combination of drugs or combination of drugs and procedures that can stop or reverse Parkinson's disease. That is our holy grail, the biggest unmet need we ever have. But we also realize that while we need to continue working on this, this doesn't just happen tomorrow. Just like a vaccine for COVID is not going to be available maybe sooner than 2020. Well, this is not just a virus. This affects every organ system in the body. Parkinson's disease affects every organ system in the body. And therefore, the cure, the holy grail, may not come in until several more years. In the meantime, you have 10 million people suffering from this illness. What do you do for them? And so what we're working on is mainly a two-pronged approach. One is our efforts to find the cure and to slow or stop disease progression. And the second is to, while waiting for that or working on this, look for things that can improve their quality of life. For example, 50% of Parkinson patients are depressed. A quarter of them are anxious and have panic attacks. 90% of them have constipation. 95% of them can't sleep at night and have difficulty waking up in the morning. And so what do you do to enhance, to eliminate or improve or alleviate these problems while waiting for the cure? So we're working on two sides of the coin here, because we need to be practical and live with the present at the same time, kind of be optimistic for the future. So those are the things we're doing.
Yeah, it's interesting that you bring that up, because clinicians are oftentimes faced with the troublesome thought of, we want to find a cure, but we're not sure if that's such a long, I don't want to say crapshoot, but it's such a long way away potentially. Whereas you could work on other things that could help some of the side effects or mitigate some of the symptoms or whatnot. So I feel like a lot of times people are kind of stuck between that decision in clinical trials, that maybe that's not the way that we should be going, because it's not something that's achievable currently right now.
Yeah, I mean, you're absolutely right. I think a big percentage of cures we've had really are accidental. We stumbled on it as we were studying the disease. And then the other half are intentional. You have a hypothesis, you chased it and chased it, and then you found the answer. But the other half is, while chasing something, you observed one other thing, and that led you to the cure. And so the good news I can tell you is that more and more scientists, because of World Parkinson Day, World Brain Day, Michael J. Fox Foundation, the awareness of Parkinson's has exponentially increased. Therefore, there are more scientists around the world working on trying to slow or stop disease progression in Parkinson's than there have been 1 or 2 decades ago. I mean, there's just so much more. And just like anything, the more people working on it, the higher the chance of an accident even happening for this. So a good accident, I mean. So that's our hope. We're looking at everything from stem cells to gene therapy to immunotherapy, human monoclonal antibodies to kind of try to arrest Parkinson's disease. In the meantime, we're looking at what we call symptomatic therapies. While we have a fairly decent offering to Parkinson patients, in that we have medications at the very least that can help minimize the tremor, help minimize the stiffness and the slowness, one, it's not perfect. And two, it doesn't last long enough. The disease progresses still, and therefore the response earlier on may not be as good later on. And therefore we need to keep upping kind of our game, because the Parkinson's disease is relentless. It poses a different challenge every month, every quarter, every year. And at some point, we're going to run out of things to offer the patient to maintain their quality of life. And that's our practical challenge as we search for the cure as well.